Welcome to the debate. Imagine a psychiatric intervention where the primary clinical tool isn't, a notepad or a quiet room or even a measured conversation.
Right, the traditional setup.
Exactly. Instead, imagine glaring studio lights, a live audience of millions, and a clinician looking a crying patient dead in the eye and brutally outlining their moral failures.
It's quite the image.
Right, because for decades, traditional clinical practice has been built on a foundation of absolute privacy. We have universally accepted the premise that vulnerability requires a shield from public scrutiny in order for genuine healing to take place.
Exactly. The closed door is sacrosanct in psychology. The therapeutic alliance is fundamentally based on trust.
Yeah.
And trust is built in an environment where the patient knows their darkest secrets, their profound shame, and their most destructive behaviors won't be used against them. And they certainly won't be broadcast for entertainment.
But what happens when you completely obliterate that closed door? Today, we're analyzing a deeply detailed firsthand account of the cultural monolith that is the Dr. Phil program.
Which is a fascinating text to dig into.
It really is. This source material gives us a front-row seat to an intervention model that completely upends our traditional boundaries. The central question we have to ask is, does this program represent a legitimate, highly skilled, tough-love therapeutic intervention, or is it an exploitative public spectacle that relies on voyeurism and shaming?
It's a huge divide.
It is. And looking at this account, I see a highly skilled professional stepping into the breach where traditional therapy often completely fails. I'm taking the position that this program offers an incredibly effective, highly accessible, radical intervention for profoundly defiant cases.
Well, I come at it from a different way. When I read this exact same account, I do not see a radical therapeutic breakthrough.
No?
No. I see a dynamic that degrades the clinical process into a low-bar public spectacle. I'm going to argue that this is inherently an exploitative format, one that relies entirely on voyeurism, the humiliation of highly vulnerable individuals, and a complete disregard for clinical ethics, all masquerading as healthcare.
Okay, well, let's lay out the groundwork of why this intervention actually works. If you were listening to this and picturing a patient with mild anxiety seeking coping mechanisms, you have the wrong paradigm. Those who are actively lying and deeply defiant.
Yeah, the text is very clear on how severe these cases are.
Exactly. And traditional therapy relies on a polite social contract. If a patient sits on a couch and lies for 50 minutes, the therapist is often trapped in that dynamic. But what this host does is deploy a technique akin to a disruptive intervention.
A very public one.
Yes, but he bypasses the polite fiction. The text shows he's a pro with lots of skill. He strips away the ego's defense mechanisms by firmly telling them right to their face just how you've been wrong. It is aggressive, yes, but for a chronic manipulator, that ability to talk so real is exactly the psychological shock needed to break their destructive cycle. Oh, and it's free. The text mentions it's therapy she got without buying, and they even get to cop a meal backstage.
Okay, but there is a massive difference between a disruptive clinical intervention and verbal abuse deployed for ratings.
I wouldn't call it abuse.
Well, you mentioned the host's ability to talk so real, but the account vividly details the darker reality of this dynamic. The author describes a profoundly disturbing moment where our guest, who has just suffered the acute stress of having her car got towed, is actively crying on stage.
Right, she was in distress.
Extreme distress. And the host's response isn't to de-escalate. Instead, he berates her, telling her that's what you get for using blow, and repeating it twice in a row.
He's making a point about consequences.
By instructing her not to be a hoe, we have to call this what it is. In sociology, there is a concept known as a degradation ceremony. It's a ritual designed to publicly strip a person of their identity and label them as a deviant.
I think that's a bit of a stretch.
Is it? This isn't therapy. It's a televised degradation ceremony where the world is literally spying on a woman's lowest moment. The text even admits the bar has been dropping low and guests just whine. That is not a clinical breakthrough.
I think we need to pause right there on the concept of the degradation ceremony, because your framing assumes the hostility is arbitrary.
It certainly reads as arbitrary cruelty.
But let's look at the actual clinical mechanics of what is happening on that stage. You bring up the extremely harsh language, and to an outside observer, calling someone out for using blow in such a blunt manner feels shocking.
It is shocking.
But consider the pathology of an addict. Addiction thrives in darkness and denial. When a guest is sitting there, actively lying or brazenly bringing a bong onto the stage, which the author specifically highlights, they are mocking the therapeutic process.
Yes, they are acting out.
They are daring the clinician to stop them.
But does the clinician have to stop them by adopting the language of a schoolyard bully?
When the patient's behavior is entirely unmoored from reality, yes. I mean, the host's demeanor is incredibly calculated. The author notes that even when he is speaking slow, the impact is profound.
So speaking slowly makes the insults clinical.
Why does he speak slowly? In high-conflict situations, when a defiant patient's sympathetic nervous system is highly aroused, they're yelling, they're crying, they're deflecting, a clinician dropping their vocal cadence forces the patient into a corner.
I see what you're saying about the cadence.
Right. The patient must either match the clinician's grounded rhythm or they look entirely unhinged to the room. It is a brilliant way to establish absolute control of the clinical milieu. He is shattering their false narrative in real time.
That is a fascinating interpretation of his pacing, but I fundamentally disagree with the application here.
Why?
Well, in a private clinical setting, yes, a therapist might use pacing to regulate a patient's nervous system. But context is everything. The slow, deliberate delivery here isn't a regulatory tool.
What is it then?
It is the rhythm of a prosecutor cross-examining a hostile witness for a jury. And the jury is the audience. You are arguing that he shatters their false narrative. But in clinical psychology, there is a massive risk known as iatrogenic harm.
Harm caused by the healer.
Exactly. If you intentionally trigger a narcissistic collapse, shattering a patient's ego defenses, you must have a safe, supportive container ready to help them rebuild a healthier ego.
And you don't think the show provides that?
The stage of a highly rated television show is not a safe container. It is a gladiatorial arena. Mocking a crying guest who is mid-sentence genuinely hoping to grow is inherently sadistic, no matter how slowly you speak while doing it.
I see why you think that, but let me give you a different perspective. Isn't this akin to an emergency room triage?
Triage? Really?
Hear me out. If you walk into a private psychiatric clinic, absolutely, you expect a safe, quiet container. But this isn't a private clinic. This is a psychological trauma bay.
Okay.
When a patient is actively destructive, using hard drugs, spiraling into total dysfunction, doesn't the severity of the intervention need to match the severity of the defiance? In a medical emergency room, doctors do not ask for permission to cut off a patient's clothes.
Right, because their life is in danger.
Exactly. They do not worry about the patient's immediate comfort. They perform painful, invasive procedures because the alternative is letting the patient die. The blunt force trauma of the host's words is the psychological equivalent of a defibrillator.
Well, I reject the triage analogy entirely, and here is exactly why it falls apart for me.
Go ahead.
In a medical triage, the doctor does not sell tickets to the waiting room. The doctor does not broadcast the cutting away of the clothes to a national audience to boost their ratings.
I mean, television is the medium, but the crucial, undeniable element missing from your analogy is the presence of the audience. The author explicitly states, "Later, we all watched her crying on Dr. Phil while the world is spying."
But she chose to be there.
A defibrillator is meant to restart a heart. Calling a woman a hoe in front of millions of people is meant to generate a collective gasp from the audience. It is punishment deployed for entertainment.
It's a wake-up call. It's less like an ER triage and more like locking someone in the medieval stocks in the town square. Sure, the public humiliation might stop them from stealing bread in the short term, but only because you have broken their spirit, not because you have healed their mind.
But that public breakdown on stage begs a massive question. If it is truly this gladiatorial, if it is nothing but medieval stocks, as you say, why on earth do these guests willingly walk into the arena?
Desperation?
This isn't a kidnapping. And that naturally brings us to the socioeconomic reality of what is being offered here. These guests are not victims of circumstance. They are active agents who recognize a profound value proposition.
Value proposition?
Yes, The author makes a point to emphasize that this is therapy she got without buying. We cannot sit here and debate clinical aesthetics without acknowledging the agonizing reality of mental health care access.
It's expensive, I agree.
It is prohibitively expensive. Most of the people described in this account could never afford 50 hours with a top-tier specialist. This program offers a high-level intervention completely free of charge. They even take care of their basic physiological needs, allowing them to cop a meal backstage.
A free meal doesn't justify exploitation.
They go into this knowing exactly what the show is, hoping, as the author says, that she will grow.
I'm sorry, but I just don't buy that. Let me tell you why. You cannot separate the free aspect of this therapy from the voyeuristic, spying aspect.
Why not? They're getting a service.
Because you argue that the therapy is obtained without buying, but the cost is astronomical. The currency they are paying with is their basic human dignity.
That's a very subjective cost.
Look at what actually happens to the guest in the account. The author notes that she became a famous client. Fame, in this specific context, is inextricably linked to her trauma. The transaction is fundamentally asymmetrical.
How so?
The host extracts incredible wealth, cultural power, and ratings from her breakdown. What does the guest get? A backstage meal, a brief moment of intervention, and a lifetime of being digitally immortalized at her absolute worst. The famous client label is a permanent scarlet letter.
I'm not convinced by that line of reasoning, because it completely strips the guest of all culpability and agency.
They are highly vulnerable.
You're framing them as helpless pawns, but the author's own worldview, as reflected in the account, suggests something entirely different. When a guest pushes back or challenges the host's authority, the author doesn't view it as a healthy boundary.
Right. The author blames the guest.
The author writes, "How dare she question Dr. Phil? For that, she should run up a hill and think about what she has done." This is a crucial insight. In the context of this intervention, the guest's defiance is recognized as part of their pathology.
Or part of the entertainment.
In a private closed-door session, a highly manipulative addict can spin webs around a passive therapist. It's just their word against the clinicians. But the public forum, the glaring lights, the audience, that environment forces them to stop hiding.
By terrorizing them?
When the guest started lying, the host immediately caught it, and the public nature of the venue ensured she couldn't gaslight her way out of it. The audience acts as an irrefutable mirror to the guest's dysfunction.
But listen to the phrasing you just defended. Forcing someone to run up a hill and think about what she has done simply because she questioned the host's methods.
It's about accountability.
That does not sound like a rigorous psychiatric methodology. That sounds like a cult of personality. It demands absolute, unquestioning submission to the host.
Sometimes submission is the first step to recovery for an addict.
If you talk to any legitimate trauma specialists, they will tell you that real therapy empowers the patient to question the process, to push back, to collaborate on their own healing.
But these aren't typical patients.
This account describes a dictatorship. If the guest questions the intervention, they aren't engaged in a dialogue. They are labeled defiant and punished with further humiliation. The fact that the world is spying creates a profoundly coercive environment.
I don't see it as coercive if they agreed to it.
The guest isn't experiencing a breakthrough, they are experiencing a trauma response. They are performing their repentance for the cameras because they are trapped on a stage with a man who holds all the structural power.
Well, we can analyze the microscopic power dynamics of that stage all day, but to truly understand this phenomenon, we have to zoom out.
Okay, let's zoom out.
We have to look at the macro impact this program has on society at large, which the author captures beautifully. This isn't just about the one person in the chair. It is about the millions of people watching.
Millions of people spying, you mean?
The author explicitly notes the profound cultural resonance of the show, remembering how in their prime, they would literally speed home to watch Dr. Phil on time.
Which speaks to the entertainment value, not the clinical value.
You don't speed home just to watch someone be abused. You speed home because the program is providing immense value, structure, and moral instruction. The author states, "I learn his lessons. He's my bro." That is a powerful parasocial relationship.
It's a parasocial relationship based on watching others fail.
For an audience that might lack strong guiding figures, the host becomes a surrogate mentor. And what is the ultimate conclusion the author draws from consuming all this alleged cruelty?
I know exactly what line you're going to quote.
The text states it plainly. The lesson is to be more kind. Despite the harshness of the intervention, the ultimate takeaway for the viewer is one of empathy and behavioral correction.
Well, if you're listening to this and thinking there's a massive disconnect between the host's behavior and that final lesson, you aren't alone.
How so?
I find that to be the most glaring, fascinating contradiction in the entire account. The author claims the ultimate lesson is to be more kind, yet they spend the entire narrative justifying a host who is berating a crying woman,
It's tough love.
kicking her while she's down after her car is towed, and using derogatory slurs. They applaud a man using aggressive posturing and then inexplicably conclude that watching this teaches kindness.
It does teach kindness by showing what not to do.
This points to a profound cognitive dissonance in the audience. The show teaches viewers how to disguise their own judgmental voyeurism as moral concern.
Or, instead of cognitive dissonance, it points to a very real sociological mechanism, cautionary learning.
Cautionary learning?
Yes. Witnessing the horrific, destructive consequences of bad behavior, the lying, the use of pills and blow, the destruction of families, it actually inspires a desire for kindness and societal improvement in the audience.
So it's a spectacle.
It's a modern morality play. When you see what happens when you abandon your responsibilities, you are motivated to be kinder and better in your own life.
I disagree entirely. A morality play implies a genuine moral core. This format normalizes cruelty under the guise of entertainment and moral superiority.
I think that's incredibly cynical.
And the author themselves inadvertently betrays the degradation of the format over time. They admit, looks like the bar has been dropping low, and follow it up by noting that every guest knows how to whine.
Which happens to any long-running program.
But that is a devastating critique of the show's evolution. It suggests that whatever clinical veneer the program might have started with has entirely eroded into a repetitive parade of misery.
They're still addressing real issues.
The guests have learned the script. They know they are supposed to whine and be defiant. The host knows he is supposed to berate them slowly for maximum dramatic effect. And the audience knows they are supposed to feel morally superior while watching it.
That's an assumption about the audience's motive.
It is a manufactured emotional assembly line. It is not a path to kindness. It is the commodification of human suffering.
But even if we concede your point that over the years it becomes a highly structured format, an assembly line, as you put it, we simply cannot ignore the very real, very material outcomes described early in the account.
You mean the temporary sobriety?
He'll help you get off of pills. That is a life-saving, tangible intervention. We can sit in our ivory towers and debate the aesthetics of his delivery system all day.
It's not aesthetics, it's ethics.
We can critique the television-friendly packaging of him speaking slow or the harshness of the vocabulary, but if the actual result is that a deeply troubled, chronically deceitful individual ceases their chemical dependency and stops lying, then the clinical efficacy is proven.
At what cost, though?
The author refers to Hume directly as a pro, which indicates a supreme level of mastery over incredibly volatile situations. He commands the room, he dictates the clinical boundaries, and he enforces reality on people who are entirely lost in delusion. That is what being a pro looks like in the trenches.
But mastery over television production is not the same thing as clinical mastery.
He's doing both.
Being a pro at extracting dramatic, explosive reactions from vulnerable people is exactly the skill set of a reality television producer, not a healthcare provider.
The text says he helps them get off pills.
Yes, the author mentions the outcome of getting off pills, but look at where the overwhelming focus of the narrative actually lies. It's on the drama. It's on the towed car, the name-calling, the crying, the spying.
Because that's what makes it memorable.
Exactly. If the primary outcome was quiet, sustained rehabilitation, it wouldn't make for what the author calls a one-of-a-kind show. The format requires the pathology to be loud and messy.
It requires engagement.
It requires the guest to bring a bong on stage. It needs them to be publicly crushed. The healing is entirely secondary to the spectacle.
Well, I think we've reached a point where we need to synthesize our reads on this incredibly layered document.
Fair enough.
From my perspective, this account outlines an intervention that is undoubtedly unorthodox.
It is brutally direct and entirely stripped of the gentle, coddling nature of traditional therapy.
We certainly agree it's not gentle.
But ultimately, it describes a one-of-a-kind, accessible service. It successfully tackles severe, life-threatening issues like pill addiction and chronic lying. It does this through the skilled, unapologetic, highly disruptive approach of a pro.
Right.
It provides necessary structure, undeniable material aid, and crucial moral lessons to a massive audience that literally speeds home to engage with it.
And summarizing my view, this account reveals a deeply flawed, inherently predatory dynamic.
Naturally.
It describes a scenario where vulnerable people, who are genuinely seeking a way to grow, are lured into an arena where they are subjected to public mockery, punitive name-calling, and the non-consensual spying of a national audience.
Even though they signed up for it.
The fact that the author themselves admits the bar's been dropping low and that it devolves into guests simply learning how to whine proves that this format ultimately prioritizes the profitable spectacle of human suffering over the actual delicate work of healing.
Despite our fundamentally divergent reads on the ethics and efficacy of this intervention, I think we have found some crucial areas of convergence today.
Oh, absolutely.
We both absolutely agree on the undeniable cultural gravity of the program described here. It commands a phenomenal amount of attention to the point of dictating people's daily schedules so they can consume it.
Yes, the cultural weight is undeniable. People really did speed home to watch. And we also firmly agree that the program intentionally elicits and relies upon extreme emotional volatility from its guests.
It's the core of the format.
The crying, the whining, the intense defiance, these are the raw materials the program needs to function. Whether you view the processing of those raw materials as a necessary therapeutic breakthrough or an exploitative degradation ceremony, the volatility itself is the engine of the show.
Exactly. The line between therapy and entertainment here isn't just blurred. It is actively, intentionally intertwined in a way that demands constant critical examination from all of us.
It really does.
This account leaves tremendous room for deeper exploration into the ethics of public vulnerability, the socioeconomic barriers to mental health care, and how we as a society choose to consume the pain of others.
It forces us to ask ourselves what we are actually participating in when we choose to tune in and watch.
It does. We started our discussion today by picturing the traditional therapeutic sanctuary, the closed door, the private room, the hushed tones.
A world away from this stage.
Right. This source material shows us exactly what happens when that door is violently kicked open and the entire world is invited inside. The sanctuary has been completely shattered, but what has been built in its place is a fascinating, highly complex reflection of our own cultural desires and our shifting definitions of accountability.
It's a heavy thought.
It is a profound question about the nature of healing versus the nature of entertainment, and it's one that will continue to linger long after the stage lights finally go down.